Don't say anything bad about me. Okay, where did you put your plans in?
I didn't have any of those. I think I just went straight to services and initiatives. Let me look on my
Oh, there it
end to
is. Sydney's Disney plan. Okay.
get.
Yeah, typically we do those under the training group, but that's fine. I'll just move it over there. Okay, so
Okay.
let me kind of walk through. So Sydney's Disney plan, I like it. Your goals is to maximize the park experience, stay within budget. I like that one. That's hard to do, by the way, at Disney. Um,
Yeah.
balance both relaxation and exploring. Okay, let me first of all let me go back to the. I'm going to just generate the report so we can see the whole thing here. That's the only place I didn't look. I was looking for plans and didn't see anything. Okay, so we're at the objective level. Wow, you did a lot of work in here. And okay, so you didn't do any activities, or if you did, let me take a
I
look.
thought I did.
Yeah, you may have, but little known fact is an activity without an end date won't show up on a report.
Ah, okay.
So we'll go look at those. But let's go ahead and look at the. Let me go back to the. Oops. The plan itself here and generate the plan again. We'll kind of walk through it. Okay, so yeah, so the service beautiful, the goals very nice, very concise, exactly what you're trying to do. Research and planning. Now, the objectives should be a little bit more specific. So
Okay.
you're going to say perform research and planning activities by the end of October or whatever it happens to be in there.
Okay. So
And
like the
develop,
smart for that.
exactly.
Okay.
And develop an itinerary by a specific time frame. Typically, the objectives are going to get you. So if you have a plan to go, let's say December 1st to Disney, then your objectives are going to have dates in there that are going to get you to that point.
Hmm.
And
Okay.
then the same thing, the activities are going to have dates that are going to get you to your objectives. So let's say we got
Okay.
appropriate accommodation selection, management of budget, develop an itinerary, dining reservations. Those are all really good. Again, I would expand those out a little bit and put some
Hmm.
specific measurables in there if possible. Developing an itinerary, there's one itinerary, so that's kind of a known thing. But
Hmm.
by the end of whatever you're going to develop your itinerary. Let's go back into here now and look at
Okay.
uh, some of your activities here. So explore Disney's website and other travel blogs for any tips without affecting planning. Okay. A performance metric would be good in here, which just says, how do I know when I've completed that? So you might want to say something
Mm.
about have explored the websites and documented the results, something like that. And then again, putting the dates
Okay.
in there. Let's see what our next one is. Hire a travel agent who specializes in vacations at Disney parks for planning. Again, a performance metric would be travel agents hired or contracted or whatever it happens to be.
Okay. So are you putting the measurable pieces in both the activity and the performance metric?
Typically, yeah, the activity, here's what we're trying to accomplish. Here's how we know when we've accomplished it, is what the performance metric is.
Okay.
So in this case, you're saying you're going to hire a travel agent. Well, that's pretty obvious, obviously. But for anybody else looking at
Hmm.
how would you know when you've done that, you're going to say, performance or the travel agent's been hired, something along that line.
Okay.
Let's go down and look at develop an itinerary. Use Disney app to plan out the trip. Yep. Okay. And then can say trip is planned or something like that. And just kind of an FYI, you wouldn't know this otherwise. That without an end date, the reports are all looking for end dates of activities within a specific range. So it goes to
Hmm.
it looks at all the activities. So this is the first one, and this is the last one, and it puts it in there. If there's no date in there, it can't put them in there. So that's why they don't appear on the report.
Okay.
But your process is beautiful all the way down, getting a little bit more specific each time, breaking it down
Hmm.
into targets with the objectives, and then the steps that you're going to go through with the activities is exactly what you're trying to do.
Okay.
So I'll give you credit for that, and I'll send you a pretty certificate. Actually, Andrea will send
Perfect.
you a pretty certificate. How about you, Megan? Did you have a chance to do that?
I did. I kind of went rogue and I did not. I actually used one of our true grants.
Oh, cool.
And then what I realized now as you were walking through Sydney's is I actually put my activities under goals. So is there a way to move them from one category to another without having to re-enter them if you make a mistake?
Unfortunately, no. What I
Okay.
what I typically will do though to make it easier, where did you put that plan?
So it is under, let me double check. I think it's under community health,
Okay, let's go down and take a
and
look here.
it's our overdose prevention.
There we go. Okay, so that's just right there. Let me go ahead and generate the report. We'll see what we have here.
So I don't have activities in there because when I realized what I did, then I mean, yeah.
Okay, so we have a goal. Goal one. Okay, let's take a look at this. Whoa, you got a lot of stuff in there. Good job.
So what I did, which is kind of our goal, I think for internally what we've been talking about is for each of the grants that we have and each of the programs, we have to do a work plan that's
Uh-huh.
laid out with the different objectives and activities and things. So really what I did was I trialed it by taking our work plan and putting what we listed out and highlighted there and just moved it over to where it should go. Well, almost where it should go within the system.
Actually, I think you got it. You got it pretty good in here. It looks like. Let's talk about. So, overdose prevention is the service or initiative. The first goal is build capacity through education, training, mentoring opportunities, TA assistance, networking. So, you're building capacity is the basic of the goal here. And then a
Mm-hmm.
situation table. Uh, what is a situation table?
So I went into more detail in the notes portion, but how we're going to like utilize or build a situation table model
Okay.
for working with our community partners.
Okay, now, so yeah, and by the way, again, same thing I was talking to Sydney about is the objective should be more specific. So you're going to establish your situation table model by the end of October or whatever it happens to be in there. So you're
Okay.
kind of putting these together in steps. Same thing, collaborate with community partners or establish collaboration with community partners by October 31st or whatever it happens to be in there. What you're trying to do is give yourself a timeline plan that says here's how we're going to get there. uh, Objectives could also be something you're doing over and over, so every quarter, collaborate with community partners or something along that line, just so you have some kind of a timeline. Now that's not a demand, by the way. That's typically how it's done, but sometimes it doesn't make sense to have timelines in there because it's an ongoing thing. Now, uh, by the way, this does look good. Again, a few minor things, with the smart objectives. However, at that point in time, you could get down to let's go to the objective level. So you don't have activities in there, but you're set up to put activities in there. So the activities in this case what would be the steps that you're going to go through to get this situation table? In fact, you may have even have identified some of them in the notes here. So we utilize a situation table model to establish collaborative network of community partners to address immediate needs of vulnerable people while working towards long term. Okay, to me, it would be I don't know anything about the situation table model, but the steps would be what are the steps you have to go through to establish that model, and
Gotcha.
then
Okay.
building the activities. But yeah, I don't think you did anything wrong as far as the levels go. I think the goals are pretty good. They're pretty specific goals. The objectives, again, should be a little bit more specific. And then at some point in time, you can build out the activities to say, how are we going to get there? Or how are we going to establish our collaboration with community partners? If you tell people that, it's kind of difficult to say, yeah, that makes a lot of sense to do, but what are we going to do to get there? What are the steps we're going to
Right.
go through to get there?
Okay.
So that's
I do have a question.
yes.
Oh, sorry. So I entered the objectives once, and then when I went back into that tab, I didn't see them again. So I re-entered them. So I don't know if I've got, I don't
Um,
know what I did wrong.
Okay, let's try to figure it out.
or where I might have put them.
Let's take a look
And I
through.
apologize for my moving
Yeah, well,
around
no,
here.
no,
I've got
that's typically why we do it in the
one of
training
our
group. But let me
one
kind
of
of
our
look
team
through.
members is out at the store and forgot our tax exempt card, so I'm having to send a quick picture.
Okay. So we were under community health, and let me go ahead and generate that report again, and just see if we can see any duplicates in there. Okay, so you say you think you duplicated the objectives in different places?
Yep.
Let's take a look down through here, see if we have any. Yep, there we go. So
Okay.
you put them under goal 1.1,
Oh,
1.1 and
okay.
1.13.
So that's okay. So here's where I made my mistake then. So rather than being in my goals and selecting the goal and putting, because those objectives that I put there, those are all of the objectives for all of our goals. So
Oh, okay.
what I needed to do was select on the goal side,
And then put the
like
objective under
goal
there.
2, and then put that objective,
Yeah.
and then go. Okay.
Now let me show you how we can do the same thing here, since you've already got them in there.
Okay.
So for instance, which goal does situation table go under?
That one goes under build capacity through education, training, mentoring,
So under
TA assistance.
1.1 here, it goes there.
Yep.
Okay, how about the second one? Collaboration with community partners.
Collaboration with, 1 second here, let me pull that up. Okay. Okay, so let's see here. Goal 1, objectives. Well, I think that's probably where my problem is as far as the activity versus the goal, because our goal would be really one that's overarching for all of them. Then
Okay.
I would have my my objective, which is the situation table, and then I have 3 activities below that, which would be building capacity through education, identification and engagement, and develop a situation table. So I think I really messed this one up.
Well, let me just
So
show you something. So you can go back and play with it and restructure it if you want. But if I wanted to say, let's say I wanted to take objective 1.1.2 and move it under goal 1.2. Okay,
Okay.
just for kicks. What I'm going to do is I'm going to go to my goals here. I'm going to go to goal 1. I'm going to select objective 1.1.2 here. This button right here is copy. So just like you're copying and
Oh,
pasting. But
okay.
if you had activities underneath that, it would copy the activities as well. But I can take and copy this entire thing by hitting the copy button. And now this paste button lights up here. I'm going to go select goal 2 here, go down to my objectives, and then I'm just going to hit the paste button here. And I'll just say copy the flags. And then it puts a little copy at the end, just so you know that it is in fact a copy, and I can save that. So now I've got
Okay.
this objective under goal 2, and if I wanted to go back and remove it from goal 1, I could just go here, hit the red X, and remove it.
Okay. Perfect.
So just
I'm sorry. This exercise, this homework, I feel like was very, very helpful. And I think this will be something that'll be really good for us to be able to kind of replicate with our team as they get going on things, because I went into this going through it like, oh, I got it. This is great. I'm doing all the right things. And then as soon as we started kind of looking at it, it's like, nope,
and that's why we do the homework, is because that's where you learn, right? As you get in there and
right.
you say, oh, what am I supposed to do now? Now, there's just the one FYI is you can always from here go up to the help, and it's going to give you specific help around goals or objectives. So it'll give you a little bit more clue as to how to do it, where to put it, that sort of thing. So just kind of a helpful tool that's right available to you. Well, if you want to take another shot at this at some point in time, if this is something you're going to be putting in there, then feel free to move it around or just start over, kind of, and create a new one and build it with the proper structure.
Yeah. So to do that, the giant red X, obviously, I'm assuming that's my delete option in the bottom right corner.
It is. And now also
So if
remember,
I just
go
go
ahead.
ahead.
If you delete, let's say if I have a service, I want to delete this entire service here. You may or may not have capabilities depending on your user permissions. But if you delete the service, you delete all the goals, objectives, and activities underneath it. So be cautious.
Okay.
But if you just said, okay, I want to just delete objective 2 down here, I can go down, select objective 2, delete it. If there were any activities underneath it, they would go with it too. So you're always deleting from that point in the pyramid on down.
Okay. So that's probably what I will try to do, is just delete the whole thing and start fresh. So that way my order of entry is correct and I can practice the proper process.
What I think I would do before you delete it is just go in here and create a new one. So hit the plus button and put overdose prevention -2 or something like that. And then build it under there. So you still have the other one. And by the way, you can go in and copy and paste. If you have stuff in there that is right, you can copy and paste it, into the new one.
Okay.
So what you do to copy and paste is at any level. So I can copy this entire plan if I wanted to. So you'd have an identical version of the plan underneath here. Or I could go down and say, okay, yeah, goal 1 is right. So I'm going to go ahead and copy it, and then you're going to go back to here. You're going to go to your new overdose prevention 2, go to the goals, and then hit the paste button, and it'll paste that exact goal with its objectives and activities as well.
Okay.
A good thing to play with. You kind of figure that out as you go. But sometimes if you got a plan like this that's partially correct and you want to redo it, why not copy most of it in there and then do it?
Right. Can you copy and paste multiple goals at one time, or is it individual?
No, one at a time, unless you copy from the level above it. So if I were to copy overdose prevention, I would be copying all of the goals, objectives, and activities.
Okay.
And by the way, a lot of people, for instance, if you have a similar strategic plan for 2024 and 2025, you copy the entire strategic plan over and then just go in and make tweaks.
Okay. Which that's really helpful, because each year we tend to have some of the same programs.
Yeah.
And so our work plans are very similar, maybe just minor adjustments. So that would really help reduce the.
And by the way, to make it even easier, let's say you're taking your strategic plan and copying it 24 to 25. So maybe it's at this level as your strategic plan. Once you copy it, just let me know. Say, hey, I've got my 25 strategic plan in there. Can you move all the dates to here? And I've got a tool that I can push all the dates all the way down to all the activities. So that way your 24 dates become your 25 dates, saves you a whole bunch of, clicking and typing in dates.
Okay, great. Thank you.
Okay. I like the idea that you guys both went through and actually created big viable plans in the system, and you had a little bit of a learning experience doing it. So now, Megan, when you're done, okay, after you've created overdose prevention 2 or whatever it is, on this one, you can just go down here and hit hide service, save that, and it just archives it basically for now. And at some point in time, you can say you can go in here and delete it, or if you don't have the org admin permissions, you may not be able to delete that. So we'll find out. But let me know and I can take care of it for you.
Sounds good. Thank you.
Okay. Any other questions on the operational planning? Okay. Today we're going to talk about performance monitoring. So let's go ahead and kind of go through this. So you guys have been through operational planning in total now. I think you got a really good handle on what the operational plans are all about. Once you have the plans in the system and the plans are executing, you need to be able to monitor them. So today we're going to talk about the different tools for monitoring. In fact, we're going to talk about 4 different tools. The dashboard itself, the macro level, which is based on what group you're looking at. Then the micro level is at the objective and activity level. It's those charts and such down there. We're going to look at 4 of the reports in the system. And the reason we're only looking at 4 is because the next training that we'll do is called 3-dimensional planning. And there's 3 reports specific to 3-dimensional planning that we won't go over because it wouldn't make any sense today. And then we're actually going to build a VMSG public web page out of the little training group that we've put in there with the tobacco cessation plan in your account, so you can take a look at it. So those are the 4 things we're going to go over. Now, the reason that those things are critical is because in the do phase where you're executing the plan is where you've got the email notifications going out, people going in and updating the status of all the plans in the system in order to get to the check phase. So the check phase is comparing the plan to the actual. Well, all the stuff you're collecting through the real-time planning is in these performance monitoring tools. So you can use that to check, our plan is to get a 25% reduction. Our actual is 25. We're in great shape. The check phase allows you to go into the adjust phase to say, hey, do I need to make an adjustment to the plan? Do I need to make an adjustment to the resources to get things back on track? So that's what we're going to talk about is this middle level here today. Now, again, kind of going down the pyramid, let's just kind of quickly go down there. Organization is your health department. Groups is the structure of your health department. We've already seen that a couple times here. Each group has a set of services or initiatives. You guys have been down there. And then each service or initiative has a set of high-level goals. Each high-level goal, a set of SMART objectives. Each SMART objective, a set of activities. Today, we're going to kind of refer back to the tobacco cessation model, so you remember that from the previous trainings in here. First thing we're going to do is look at our groups screen, and within our group screen is where we're going to have the dashboard. So I'm going to take you back to the USA Public Health Department because I know the data that's in there, and I don't know all the data that's in yours yet. So I'm going to go to USA Public Health and go to my groups. Now, when you log in to the system, you're going to be taken to your default group, whatever that is. In the case, if I'm the health director, I'm probably going to go to the department level. If I'm, in this case, I'm the community health director, so it's going to take me right to community health. We do that for a reason. Number one, I want to go to my area of responsibility without having to search around. And some people have, 100 different groups on there. So in this case, it's going to take me right to my group. So the dashboard is dependent on which group you have selected. So if I click on this traffic light right up here now for the dashboard, it's going to take me to the dashboard specifically for community health and its 2 subgroups here, tobacco and WIC. If I were on the department group up here, it would take me to a dashboard for the entire department or maybe just the strategic plan. So you're going to select a group, which could be your default group, and then you're going to hit the dashboard button up here. Now, some people aren't going to be in the system, entering new plans, updating plans. They just want to be able to have a view of their dashboard. So if I'm the community health director, probably all my team is updating the plans and putting in the plans. I just want to know how we're doing in community health. So to do that, I can click this homepage button. When I do that, I'm going to get a little dialogue that says, do you want to make this your login homepage? So when you log in, you go to the main menu. You can select either the main menu as the default, or I can say, make the dashboard my home page. So as soon as I log in, it's going to take me to the home page, in my case, for Community Health Division. If I were the health director, it would probably take me to the home page for the entire department on one screen. So everybody can get to their home page if they want to. And again, this is typically for people who are just looking at the result and not inputting data in the system here. The other, again, you got the main menu. You can select, got the same button up here you can select, and the reports menu. So if my job is basically to generate reports for the health director or whatever, I might make the reports menu my default homepage. So when I go there, I just click on one button and I'm there. Trying to make it easy for everybody. This button here is showing me what am I looking at. I'm looking at USA Public Health, the organization, and Community Health Division as my department in here, or my division in here. Over here on the left, I can select what level of the pyramid do I want to look at. So I'm looking at the number of traffic lights in each status here. So we got activities, objectives, and goals. So I'm looking at the activities. And you can see between the red, the yellow, the green, and the gold, we have about 10 activities in here. One really nice thing is everything on the screen is clickable. So I don't have to go anywhere else. I don't have to navigate around if I want to see, what this red activity or, what are these 3 yellow activities. I'll just click on it here. It's going to take me to a screen with the 3 yellow activities in there. Now, the nice thing about this is that I can actually go in here and say, okay, William is responsible for activity number 1. It's sitting at yellow. Maybe I'm going to give William a call and say, hey, why are we sitting at yellow down here? Says, yeah, typically you can also look at the notes down here. It's going to have, in this case, it doesn't make a lot of sense. It says 9 training sessions were completed in March, scheduling April sessions here. He's got it marked as yellow. The reason it's yellow is because we had only completed 7 training sessions. But anyhow, the idea here is that I can get right to those 3 yellow objectives so I can make the decisions as to what I need to do and then go back to the dashboard. From any place you drill off of the dashboard to get back to it, you can just use the back arrow here. Now, each time I do that, it's got to recalculate the dashboard. The reason for that is even though I made no changes on this screen, there's other people working in the system, and other people's work can also affect my dashboard. The people who are down here at the bottom who are doing updates and things like that. So again, the first thing I look at is the number of activities in each color. The next thing I see here is a schedule gauge. This schedule gauge says overall across these 10 activities, we're 35 days behind schedule. You get to 60 days, it turns red, and you get on schedule, it turns green. The way this is calculated is pretty simple. Every activity's got a beginning date and an ending date. So if the beginning date were January 1st and the ending date was December 31st and today was July 1st, I'm exactly 50% of the way through the year. If I have an activity that is only marked as 40% complete, I'm 10% behind on that activity. 10% of 365 days is 36, 37 days behind schedule. Now, if I have another activity that was 10% ahead of schedule, so 60% completed, I'm now 35, 36 days, 36, 37, 365, 36 or 37 days ahead of schedule. The 2 of those would zero out basically. So what this is saying, if I add up those date and times for all of these activities, right now we're 35 days behind schedule. Doesn't mean they're all behind schedule. Some of them could be ahead of schedule, some of them behind, but aggregately we're 35 days behind. Down here at the bottom, the first thing I look at is my activity leaders. So this is the people that we assigned as activity leads. This column is telling me when did this person last update their information. Green is less than 30 days ago, kind of your optimal point. Yellow is 30 to 60 days, and red is over 60 days ago. So ideally, I'd like everybody to keep the updates up to date here so I can have all green and know I'm working with the latest information. The FTE column here basically says that if I use the FTE value in the activities and I assign that to people for budgeting or grants or whatever, I want to make sure I'm not overloading anybody. So I want to keep everybody at a 1.0 or below FTE. So it just gives you the ability to look at the total assignments by person here. The lagging column says I have activities that are calculated to be behind schedule, same calculation we did up here. The days here says Diane is overall across all of her activities 53 days ahead of schedule. The overdue column says I have 2 activities that the ending date of the activity is before today and the activity is not yet 100% complete. And then the number of red, yellow, green, and gold. Now, again, I can click down on this particular activity here, or I could go look at these gold activities, anything I want. I can click on anything and get right to the data elements behind it. So that's my view 1. View 2 is my groups. So as I mentioned, I'm looking at Community Health Division. Community Health Division had 2 subgroups, WIC and tobacco. So those community health shows up here, tobacco and WIC show up down here. The reason we bring in the first level subgroups is because the people who run these groups are reporting to the Community Health Division. So we want to see the entire sphere of influence, if you will. Same basic information over here as we just talked about. My third view is priorities. Priorities are the strategic priorities from your strategic plan mapped against everything else in the system. Now, I'm not going to go into the detail on how we do that mapping because that is the next training, which is the 3-dimensional planning training. But basically what you're seeing is the services or initiatives from your strategic plan show up down here, and then the same basic information over here. So what we're doing is comparing our strategic initiatives to everything else we're doing. So how is our strategic plan performing? Top right corner, my priorities. These are individually selectable objectives. They appear only on your login. So you pick the ones that you want to keep your eye on. Everybody can pick their own. They can pick the same ones, but a lot of people pick the ones that they're working on. So typically they're going to be reds and yellows. And typically they're going to be things that either you're working on personally or your team's working on, and you just want to keep them front and center. The way they're set, let's say this green one just turned green. I don't need to watch it anymore. So I want to take it off there. I'm going to click on it. It's going to take me right to that particular activity or objective. Now this is the flag that turns that on and off. So if I click on this green flag, you notice it turns gray. When I go back to that dashboard screen, it's going to recalculate it. When I go back there, that one will be gone. So that's all there is to it, is that's that little flag. You turn it green, it appears, you turn it off. You can go to any objective that you have access to and click on it if you want to keep it up there. So, and you can have, by the way, this will scroll forever. You can have as many as you want. Most people just have a couple of them, that are kind of in trouble and you need to keep them front and center. So that is the dashboard. That is macro level performance monitoring. And you can do it on your phone. So same link, login.vmsgdashboard.com, same login credentials used on your desktop. On your phone browser will take you right to this app. You don't need to download an app. There's no app. We did that on purpose because some health departments limit what you can put on your phone, due to bad restrictions and things like that. So what we did is we built what we call a dynamic app, meaning that it's in the web browser on your phone, just like it is on your desktop. Same link, same login credentials. It knows it's a phone. It brings up this. This is the same screen you just saw broken down into 3 phone screens. Top left, bottom, top right. These little blue arrows take you back and forth between the 3 screens. Everything that you see on these screens, again, is clickable. So if I wanted to take these My Priorities on and off, I could just click on them with my finger and unset the green flag, and away I go here. All of these are clickable over here. Got my schedule gauge, got everything. So basically the same functionality, except you don't have to be sitting at your desk to get to it here. So that is macro level, we call it. That's the dashboard. Questions on the dashboard? Pretty easy. Yeah, it is nice though, because as you're looking at, for instance, accreditation, you've got an accreditation plan. You can have a dashboard for the accreditation plan, which will give you specific details on exactly how you're performing against the accreditation plan or your strategic plan, whatever. Okay, let's talk about micro level performance monitoring. So that's the charts and graphs down at the objective and activity level. So I'm going to go back up to here, and let's see, I'm going to go down to my tobacco group, and we'll kind of go back down through that. Tobacco cessation, reduce smoking in high schools, and then reduce smoking at my old alma mater, Wayne High School in lovely Dayton, Ohio, by 25% by the end of the school year. The target is established here. Our target is a 25% reduction. What I want to know is, how are we doing so far? Now, Steve's job is, number 1, to get us to this target, and number 2, to keep the current status up to date. Wherever he gets that information, he's going to be updating it. This is the line chart button right here. So I'm going to click on that, and it goes back to the very beginning. So when we started on August 15th of 23 and ramped our way up from 0 to 25%. So that's all there really is to the line chart. Now, there's some tweaks that you can make to it. Up here at the top, you see a beginning and ending date. So you notice the date range goes from August 15th, 23 to June 30th of 24. If I wanted to have a chart in here that was just 2023, so maybe I've been doing it for years, I just want to cut out 2023. I can go in here and just put in my dates. So it's maybe 1/1 of 23 through 12/31/23. And there we go. So we've cut out everything to the right, basically. So it allows you to clip the timeline down. When you do that, you got a couple of choices. We call time frames. So raw says, show me every data point in the system here. The days says basically 1 per day. So if you happen to be entering more than 1 data point a day, which is unusual, or 1 per week, per month, per quarter. Months is not too unusual, by the way, because maybe you're at the end of every week, you're updating your information. When I show this chart, I just want to see 1 data point per month. I don't want to see every data point. So that's what this is telling me up here. The data that I'm looking at is the last value for the time frame. So let's say we're doing it once a week, we're updating the information, but I want to see 1 per month, and I want to see the last data value per month. So by selecting on that, I'm saying we're going to look at not week 1, not week 2, not week 3, but just week 4 of the month in here. The other thing I have a choice of is the average. Now, if I had a chart like this, I probably want to see the last value because it's continually climbing and I'm hoping it will continue to climb. If I have one of those activities, remember we had one that says provide 9 training sessions per month. That's going to be kind of going up and down here, hopefully, staying right around 9, but sometimes it's going to be lower, sometimes higher. I might want to select the average value. So instead of the last value for the month, I select the average value. So I can see each month, what is the average value for the month that we've been doing in here. So those are my choices up here. Again, raw is kind of the default, says show me every data point. And if I go in here and put in 24, it's going to give me all the data points in there. Over here on the top right, you may recall at the objective level, down in the bottom left corner, there's a little tag that said objective % done, and then there's a little field next to it down there. And you can change that. And when you change that, you get a little dialogue that says, are you going to be looking at % or are you going to be looking at values? So this is what brings up this drop down up here. We're looking at %, as you can see here. So I'm going to leave it as %. The scale. The scale over here on the right says 0 to, looks like 27%. The auto scale takes the highest value, in this case 25%, and multiplies it by 1.1 or 110%. So this is really 27.5. You notice it doesn't show halves in here. So this would be 27.5%. The reason for that is to give you the most vertical scale here to be able to look at it and say, yeah, it looks like we're really growing. I do have another option, though, and that is 100% scale. Now, to me, it's exactly the same data, but it doesn't look as good. It doesn't look like we're making as much progress because it's not moving up as quickly. So that's kind of what the auto scale is about, to give you the most vertical scale in there. Now, once you make these settings up here, if you want, let's say you're the objective lead, this is the objective, and this is how you want people to see it, and you are a manager level user or an org admin level user, you'll have this button. And when I say save this, it's going to save exactly what I have here as the chart that everybody sees when they go into it. Now, if another org admin or a manager level user goes in there, they can tweak this again, and then they can save it, and it'll stay there for everybody else who logs in. If a normal user, we call a normal system user, goes in, they don't have this button at all. They're going to see whatever you saved as the default. However, while they're in there, they can make all these tweaks temporarily. So they can change the dates, they can change the average to last value, they can go to 100% scale, and they can take a look at it. When they go out and go back in, it's going to go back to the default settings that you'd already set in there. So org admin and managers can change it and save it. Normal users can just look at it and temporarily change it. So that is the micro level performance monitoring. And then the question comes up is, where did all these data points come from? Well, let me show you that. So we're going to go back to our tobacco and navigate our way back down to our objective here. Every time you hit the save button, it creates a history record. The history records are here in the hourglass. So I'll click on that. And you can see they're in reverse chronological order here. So back on 8/15 of 23, Fred Erickson added a green objective number 1, and it was currently at a 0% reduction. And then you can follow it as you go up here to the latest one on 6/30 of 24. This chart where it says status over here is what we're actually mapping into that chart over there. Now, a couple things you can do from here. We've had this issue quite a few times. It's really minor, but let's say you're showing somebody your plan in the system, and you go in and you change the value and you save it, and you generate a new history record, but it's not a valid history record. You don't want to keep it. To get rid of it, it'll be the top record up here. You're going to go up and click on the date. It shows up down here in the bottom. Hit the red X. You'll get a little dialogue says, you sure you want to delete this history record? And boom, you've deleted the history record. So if you have duplicate records or anything you don't want in there, you can just click on the date anywhere here, and you go down and delete the record. The other thing you can do is change the date. Now, sometimes you're going to enter a record and say, oh, that was in the wrong place. I need to change the date. You can do that. But typically what that's used for is entering historical data. So let's say we were doing the tobacco cessation program, managing it at Wayne High School before we implemented the VMSG dashboard. And I want to go in and I've collected that information in a spreadsheet and I want to go and put that information in there. So what I'm going to do is go back to my spreadsheet. I'm going to go to this screen and I'm going to update the values on the bottom of this screen, the percent complete and anything in here that I've changed, the traffic light or whatever. I'm going to change that. I'm going to hit the save button. When I do that, it generates a new history record. Then I go back over to here. It'll be at the top. I'm going to take the date here. Let's say this is a record from 6/30 of 22. So now I can go down and change this date down here to 6/30 of 22, hit the save button. It'll move down to the bottom here because it'll now become the first record, and I've created a new history record. So that's what that's all about. Not done. Typically, it's done one time when you start the system and never done after that. There's not a whole lot of reason to do that, but you do have the capability to do that. So these are all of the data points that are being mapped on that chart. And that's where they come from. So again, every time you hit the save button, you're going to generate a record. If it says, hey, you haven't changed anything and you hit the save button, it's going to say, do you want to create a duplicate record? You may or may not want to do that. If you don't want to do that, just say no and it won't create the record. If you do, you're doing it for a reason, maybe to add that historical data in there or something along that line. So that is micro level performance monitoring. Questions on the micro level here? Nope. Okay. As I mentioned, we're going to talk about 4 reports today. We're going to talk about, let me get the big screen up here. I'm going to go to my reports menu. I'm going to go to the groups and I'm going to go to my reports menu, the blue one up here. So operational plan is the one you'll use 90% of the time. It's kind of big and special and tweakable. There's other reports down here that we're going to talk about today. The team lead report would be probably the second most used report. The partners report and the partner activities report are reports that we'll be talking about today. What we're not going to talk about is the category tag report, categorization report, and the categories report. Those are specific to 3-dimensional planning, which we'd like to schedule, for the next training. Typically, we give you guys about a month to get stuff in the system, and then we do the 3-dimensional planning because it makes sense to. 3-dimensional planning is kind of cross-linking everything in the system. So first thing to know is that reports can be at one of 2 levels. If I go here in my groups tab and I select tobacco 2024, and I go down here at the bottom, we call this a cookie crumb. So you'll see when I roll over, you'll see the tobacco programs, and then over here you see nothing because there's nothing in there. So if I generate the report now, it's going to generate the report for the entire group, all of tobacco 2024, which would include all 3 of these initiatives here. Now, down here at the initiative level, and because I can see that there's an initiative called tobacco cessation down here, if I generate the report, it's just going to be for tobacco cessation. Some plans start at the group level, some plans start at the service initiative level, so you got the options to do both here. Or I could say I just want to see the secondhand smoke report or the tobacco initiation report. Now, if I go back to my groups tab, this is still here. I haven't got rid of it yet. To get rid of it, I just click on the group again, and now it gets rid of it. I'm going back to generate the group report. So to generate the operational plan report for this group, I'm going to go to my reports menu, go to operational plan report, give it a second here to generate the report. Okay, so this is the tobacco programs for 2024 group. Typically, we start off with the vision, mission, and values at the top of the report, just kind of a reminder why we're here. And then the report itself. So down here, we're looking at the group of tobacco programs for 2024. The initiative was tobacco cessation. And as I remember, I did it at the group level, so I have the other 2 initiatives down here. Now, the reason there's nothing underneath them is because there's no plans underneath them. We haven't entered anything in there. But I'm looking at all 3 of the initiatives here. Under the initiative, you see this, okay, let me turn this off for now. Okay, so we have the goal, reduce smoking in high schools. Everything in blue are the notes that you put in there. And then down here, we have the objective. We have the notes for the objective. We have the data source that we established down there. That's that link that you can click on to go to, in this case, the CDC Smoking Cessation Fast Facts webpage. You'll see we have the activities down here with the team members of the activities, We have the team lead for the objective down here. We got the notes. We got everything we want to know, but we're afraid to ask. So that is the operational plan report. Very, very detailed, very complete. Couple things you can do up here. Every activity's got an end date. So this is when the activity was supposed to be completed. If I wanted to go in and say, okay, what was I supposed to have completed in September? I click on the little calendar here. It's got a beginning and ending date. I'll put in maybe September 1 through September 30th, and it's going to filter out every activity that's not supposed to have been completed in September. So that's what that's about. Again, I could do the same thing. We're into October now. I want to go, hey, what am I supposed to get done in this plan in October 1 through October 31st, and it's going to show me every activity that's supposed to be in that time frame. The documents button you already saw up there. When I click on this, it's going to show me all of the documents that are attached. Now, documents can be attached anywhere in the system. So you'll see they appear in green. So it says we have one document attached to the Tobacco Cessation Initiative. We have one document attached down here to the goal of reduce smoking in high schools. If I go down a little further, it says we have two documents attached to the objective of reduce smoking at Desert Vista High School. And then down here, we have one document attached to the activity. So the documents appear right below the planning element that they're related to. And if like this one, you can see we have two documents separated by a semicolon in here, and you can have 100 different documents in there if you want to. So that is the documents. Now, over a period of time, you're liable to have a lot of notes in here. So you're adding notes every time you do the update. You could have pages of notes in there. If you're trying to just look at the plan and see what am I supposed to be doing, sometimes they kind of get in the way. So we put this little button up here to hide the notes. So when I do that, it's going to just take everything in blue out of there. So it just gives you the ability to look at the plan without having the notes in there. Go back to rows. When it says rows, that means put the notes in the rows underneath the planning element that they belong to. Over here in the top right, right now I'm looking at every level of the pyramid, all the way down to the activity level. If I just wanted to look at the objective level, I could click here. And now you see we just have the two objectives in here. We don't have any activities on there. Or I can say I just want to look at the goal level here. So down here, now we just have the three goals in there. And you can see we have the notes in there. We have the document in there and everything else. Or I can say I just want to look at the service level, which would be services and initiatives. And sure enough, we just have the three initiatives down here. The reason I show you this before I show you this little drop down is, depending on the level I have selected here to the right, I can filter by the traffic lights in that level. So right now I'm going to say I want to filter out every activity that's not red. So I'm going to select, I just want to see red. So when I go down here, it's going to go down, and
I have a question for you.
Yes, ma'am.
While you're pulling that up. So I'm kind of following along on the steps with the overdose prevention one that I had created earlier.
Right.
And I see on my report there's a CH vision and a CH mission. So I imagine that stands for Community Health Vision and Community Health Mission.
Right.
So that would be something that we would have entered then under that tab, which we haven't done yet, but is that right? We would enter our vision and mission for that.
Yeah, typically vision and mission are the same across the whole department, right? Sometimes they're a little bit different, but let me show you. So let me finish up with this report, and then if you wouldn't mind reminding me, I'll show you how to do that. But it's just real easy to do. You can do it at the department level and roll it down to every division, and then if you need to tweak it, so maybe community health's a little bit different or something. So what I just did is filtered activities to red. So the only activity that shows up down here is the one in red. If I were be selecting objectives here and say objectives yellow, I would show just this yellow objective and not the green ones that are in there. So I'm filtering by traffic light. And this, in a little report like this doesn't make a lot of difference. But if I had 100 activities, it might be nice to just go say, hey, show me what's in red up there. So these are the tweaks that you can make to the report. Now, how do I get this report out of the system? Let me go back to all here and leave the documents in there. To get it out of the system, you got a lot of different options here. They all start with pushing this button. So I click on that. It says, okay, I'm going to save my report. The default is VMSG report.htm. HTM is an HTML file. So I'm going to go to my desktop and I'm just going to plan it on my desktop here. It's going to download here and then open it up for me. So I'm going to say VMSG report.htm. So I've opened the report with the vision, mission, and values and everything at the top, as you can see, in a new browser window. The nice thing about this report, may or may not be good for you or not, is that it is a web page. This is a highly formatted, structured web page, the HTML file. Once you have it in the web browser, you can use all the browser functions to do whatever you want to do with it. Typically, you're going to go to the print. You can print to a PDF file. You can print to a printer, obviously. Anything else you have under the print, you can do, or anything you have in here, you can do with it. Now, I do recommend that if you're going to print it, that you flip it to landscape mode and narrow margins. It'll print the cleanest. It'll adapt to anything that you do. If you want to print it landscape or in portrait mode or whatever, it'll adapt. But typically, it looks better this way in here. So I got a web page, so I can grab that link, that file. I can put it up on our public-facing web page if people want to see the current status of our tobacco program. You can give them that detailed report in there if you want to. I can print it. I can make a PDF of it. The other thing that a lot of people like to do with it is throw this into a Word document. So HTML format is pretty much identical to Word, Microsoft Word format. So if I click anywhere on here and hit Control A, that means select all. And then I hit Control C to copy. Pop open a Word document, flip it to landscape and narrow margins, and paste it in there. Control V, paste it in there. It's going to look exactly like this. But once you're in Word, then you can go in and say, okay, I don't want to have my vision, mission, and values on this particular report. So I can just go up here and highlight them and delete them. I can, say, okay, I'm looking at tobacco cessation, and I make a yellow highlight on that or something. So anything you can do in Word, you can do in the report after you get it in there. So those are kind of the options that you have. So before I go to the next report, I'm going to show you vision, mission, and values here. So up at the group level, typically you're going to start at the department. You're going to go to vision, mission, and values. So I have the vision of the whole organization, the mission statement, and then the values down here. To get those down to any other level, like let me pick a group that I don't think I have anything in here. Let's see, finance, if we have it in there. Nope, already have it in finance. Community health. Oops. Yep, already have it in community health. How about critical documents? Okay, so it's not in there. So what I did is I selected a group that reports directly to the department, or any if I have them in my strategic plan, I could have a group under strategic plan. It's gonna copy them down from the previous group. So we know in the departments we have vision, mission, and values, and we know that this group, critical documents, is related to the department group. It's a subgroup to the department group, as you see down here. To get the vision, mission, and values, I just hit this copy button, and sure, I want to copy it, and poof, presto, they're there. So now those will appear on the report. Now, in this particular group, it may be that they're a little bit different in here. I might want to tweak the vision or tweak the mission, something along that line, but typically they're going to be the same across the entire department. So once you guys get the vision, mission, and values into the department level, then you can copy them all the way down to every group underneath that. Does that make sense? And does that answer your question, Megan?
Yep. Could you do that step again for me one time? Because when I'm on the department level, and then was it okay? So
okay,
when I go to
go to the department level, and this is if you have your vision, mission, values in there.
Yep, and they're listed in there.
So go down to your community health group, and then go look at vision, mission, and values. It probably doesn't have anything in it, right?
Right.
Okay. Go to this little copy button over here on the right, the little 2 pages.
Uh-huh.
Click on that, and then on the dialogue, say, yep.
Oh, perfect. Okay. So then the value, if that is that not as relevant to pull across?
It should be there if they're in your system. I think you guys may have had just one value and not a list of values. I'm not sure.
Right. Yep.
You can fix those. Yeah, you can just go down at the bottom here, and you can see where you can edit those.
Okay, great.
Okay.
Thank you.
Okay, you're welcome. Okay, so let's go back to our tobacco here. I'm gonna go to community health. So that was the operational plan report. Again, 90+% of the time, that's the report you'll use. Let's talk about the next report here, which is the team lead report. As you recall, every activity and every objective gets somebody assigned to it. At the objective level, it's just a team lead. At the activity level, it's a team lead and team members. So what if I wanted to find out, so I've got Andrea selected here. If I wanted to find out every objective that Andrea is assigned to as a team lead, I'll go down here to the bottom and I'll select individual, meaning of these 3 people in the community health division group, I'm selecting just Andrea. If I say group, it's going to select all 3 of these people. If I say all, that means the entire department. So it's going to show me a report that everybody in the department is attached to. It'll take a while to generate that report, so just be cautious if you're using that. For now, I'm going to select just Andrea. Over here at the bottom right, I can say, do I want to see the activity she's attached to or the objectives? I'm going to go ahead and say objectives for now. When I have objectives selected, this middle block doesn't mean anything because this is for activity lead, team members, or either a lead or a team member. So in this case, if I had activity selected here and I say lead, it's just where Andrea is the lead and not necessarily just a team member, or just a team member and not the lead, or either a team member and a lead. So if I'm over here at the objective level, there's only a lead, so that's all it's going to give you. 2 buttons down here. The magnifying glass says, just give me an editable screen. So let's click on that. And there it is. So these are all of the objectives that Andrea, as you can see, is assigned to down here. And where this kind of, whoops, looks like we just lost Sydney. Should we give her a minute to come back on? Or? Did we run over time or something, Megan? You're muted. I'm sorry. There you are.
Oh, sorry. Looks like she put a message in the comment or in the chat. I didn't see that. She had an appointment she had to jump off for. Sorry about that.
Okay, okay. Yeah, we're a little over time here. Okay, so let's kind of finish up these real quick. So the purpose of this is to go in and say, I want to see everywhere Andrea is assigned as an objective. You had the option to do the same thing with activities. And this isn't the case where Andrea's leaving and you're going to replace her with somebody else. So I can select these specific objectives without having to search anywhere else, pick the new person who's going to go into here, and away we go. So that's the team lead report here.
Okay.
So again, I can select activities. I also have the option to just generate a report. So it's a operational plan report, and it'll have just the objectives that Andrea is assigned to.
Perfect.
The next report is the partners report. So eventually in the system, you'll have your external partners in there. This report just generates a list of all the partners or specific details about a partner. So over here, I've selected VMSG dashboard. I'm going to say, do I want just VMSG dashboard? I'll say, no, I want them all. Do I want to print the contacts within VMSG dashboard or within all of them? I'll say yes. And do I want details, meaning do I want email addresses and phone numbers and such? I'll say yes. And I'll click on this. And that's all it is. It's just a report of the partners. So you can see up here, Andrea's car seat installation, got the address and everything. It's got the contacts, Andrea and Fred, and their phone numbers and email and all that stuff. This is nice once you get into the system a lot and you have a lot of external partners. It's just nice to know that, hey, oops, Bill's car seat installation is no longer working with us. Let's go take him out of the system.
Mm-hmm. I like being able to go and get all of that information in one spot and be able to just access it very quickly.
Yep, exactly. Okay, and then the last report here we'll talk about is the partner activities report. So again, I'm going to go down to VMSG dashboard. On the left side of the screen is the partner organization. The right side is the contact within that organization. Down here at the bottom, we have kind of those same buttons. This is the search button, which says, give me an editable screen for all the partners for VMSG dashboard as an organization. This is give me the same report. And then over here, I have give me the editable screen for all of the activities that Fred Erickson at VMSG dashboard's attached to. So if I had 5 different people down here and I just wanted to know where Fred's attached, not the other ones, I'd use the right side. If I want to know where anybody at VMSG dashboard's attached, I'd use the left side. So in this case, I'll just go ahead and generate the report for Fred Erickson, wherever he's attached to activities in the system here. And eventually it will show it to us. There we go. Okay, so what I've done down here is up here it says the partner is VMSG dashboard, partner contact Fred Erickson. And then down here you can see in the dark font is all of the different activities that Fred is assigned to down here. Where I like these reports, this one and the team lead report, is a lot of the managers like to do one-on-ones with their staff. So let's say every month you're going to do one-on-one with your staff. You generate the team lead report for Andrea before you meet with her, give her a copy, you take a copy, and you just walk through. Say, here's everything I show that you're doing in the system here. Are we up to date on here? Is there anything we need to add or remove, whatever it happens to be? Same thing with your partners. If you're doing a quarterly partner review, you can sit down with this report with the partners and do the same thing. Just say, hey, this is everything that we think you're working with us on in the system. Are there other things? Are you done with any of these things? What do we need to do to update it?
Right. Okay. That's great.
So that was the reports. One last thing I want to go through, and that is the VMSG public. Do you have a few more minutes?
I do. Yep.
Okay, so I'm going to go back to your organization here. West Central Nebraska. So what I'm going to do is I'm going to use the training group down here, the Tobacco 2024, and our initiative is tobacco cessation. So at any level, you can see I have this button here, which is a VMSG public. So I'm going to say, let's start at the service initiative level, tobacco cessation. And what I'm going to do is what we call generating an indicator row. So it's a row in a web page. So I'm going to click this button and say, what level do I want to summarize the traffic lights, the goals, the objectives, the activities? I'm going to pick activities for today. I can summarize at any of those levels here. Click the save button. It's going to generate the indicator row. So this is the tobacco cessation indicator row, the number of gold, yellow, and green. And if there's red in there, it would show up in there. And we're 56 days ahead of schedule. Looks great. Let's go ahead and save that. So we've saved that. You can see we have that first indicator row. Now, underneath the service initiative, I have goals. So I'm going to go ahead and say, let's do reduce smoking in high schools. So same thing, push the button, activity summary, click on that. It's going to give me, it'll look the same because it's the only one we have in there. So I'll save that. And I can go down to any level. So now underneath that, I'm going to go down to my objective level, say reduce smoking at Wayne High School. Click on that again. Because it can only summarize at the activity level, it does that automatically, so it doesn't ask us. Again, the same rollover, 93 days ahead of schedule. And now our last one is reduce smoking at Desert Vista High School. I'll go ahead and generate that. And we have, looks like 2 complete and 1 yellow, 6 days ahead of schedule. Save that. Now I can also go back at the objective or activity level. And let's say I want to look at a little tiny line chart. So the same micro level performance. Hang on a second. Let me get to the Wayne High School. I think has data in it here. There we go. I'm going to take this down to my auto scale. So if I wanted to generate this line chart in there, I know why that is. Okay. It's because we entered it into your system here. So I can do the same thing here. I got the same little button right here. I'll click on that. So it generates just basically a miniature version of that line chart. I'll go ahead and say, add that on there. Now this was for Wayne High School. Right now I'm under Desert Vista. So I want to probably move it up to here. to do that is all I have to do is say, we got 10 between them. So I'm just going to say 35. So I'm going to put 35 in here, save that, and it'll move that up. Now, the select over here determines which rows show up on my web page. Right now, I want to have all 5 of them. So to get to the web page, all I do is hit the export button here, and there it is. So here's the Tobacco Cessation Initiative. Underneath that is Reduce Smoking in High Schools. Then we got Wayne High School. Then we have the performance chart for Wayne High School. And we got Desert Vista High School. And we could have as many rows as we want down here. So that's easy to create the web page. And this gives you the current status. Now, I'm going to go ahead and say save that. I'm going to put in here training demo page. And we'll just save that. And so this is the link. If I click on that, it highlights. I can hit Control C to copy it. Let me go ahead and just open up a new browser tab, paste it in there, Control V, and there's our. So you can put this link in an email, send it out to the board maybe for their meeting.
Okay.
You can put it on your public-facing website so that people can see what it is. Now everything on the left side here is kind of a mini web page in itself. It's all formatted in HTML for that reason, so you can actually make it's going to be the way that you see it here if you don't do anything with it, which is the norm 99% of the time. But if you wanted to kind of get in there and get clever and do some things, you can do that. And the way you do that, you're going to go to the main menu, scroll down to Manage Public, VMSG Public Manage Performance Indicator Rows. Blah. So you'll notice down here, the bottom row down here has font, face, Arial side, blah, blah, blah. This is all HTML code. You don't have to touch it. It's going to look exactly like that. You can get rid of all this code and just put in Reduce Smoking at Desert Vista High School, and it'll just show up that way. But this gives you the ability, if you wanted to, if you knew things about HTML or wanted to learn, you can customize it. Now, we use 4 different tags in here by default, and I'll show you those. So font, so just like in Word, you want to change to Arial or Calibri or whatever you want. You just go in here and put in open bracket font, face is Arial, size can be between 1 and 7, I think. Color, you can put in whatever you want. It'll find something. Navy, dark blue, dark green, whatever it is. And then whatever text you're working on comes in here after this little greater than sign or close bracket. And then to close out the tag, you put in a /font over here. And what happens basically, all of this makes this like this. So it's a blue Arial font text. So that's the big one. Bold is real easy. You put the bracket B and bracket /B around it and it bolds it. Italics, the same thing. Bracket I, bracket /I, italic text. You can combine these two together. So you put the bracket I in front of the bracket B and a bracket /I behind the bracket B, and you'll have bold italics.
Okay.
And then BR is just a line. There's no close tag for BR. It's a line breaker carriage return. You can put as many of these in a row as you want. So bracket BR, bracket BR, bracket BR gives you 3 vertical line feeds in there. So it's carriage return. So these are the ones that we use. Now, if you wanted to go in there and play with that, again, at the this level right here, you can go in and change anything you want to change in here, put different fonts in here. Some people put graphics in there, so you can put a link to a graphic in there. Here's something that I saw people do that was pretty clever. They had their entire strategic plan in here at the top row, and then each of the strategic initiatives in a row below it. And then on the left side, what they did is they created an operational plan report for that strategic initiative. And then they put a link to that in the left side, and it said, for more detail, click here. So you had the chart, and then you had a link that takes you to the excruciating detail of the operational plan. So you can do a lot of different things if you wanted to play with it. Again, 99% of the people just do it this way and just leave it as this. But you do have the option to make changes in there if you want to.
Okay, great.
And that, ta-da, was the drink of a fire hose for the day.
Perfect. This is exciting. I feel like I learned a lot with the homework and walking through that. And
good.
Different reports are going to be really helpful for even just our quarterly reporting that we have to do on our different programs. So yeah, this is going to be very good.
If you decide to go in and kind of work on that plan that you created again and redo it, please do me a favor and just pop me a link and say, hey, take a look at it. I'd love to take a look at it, and I'll give you some feedback on it.
Okay, that sounds good. I will. I've already created a copy within there.
I like it.
Yeah.
You're going to be our resident expert. Be careful.
Oh, I don't know.
Yeah, you will. Okay, Megan. Well, if you need anything, you got my contact information. Please feel free to reach out and tell Sydney thanks for joining us when we could. And sorry we were a little bit late.
That's all right. It was good information.
Have a great day.
Thanks, you too.